we'll have some feedback if we don't. Thank you.
And if you are a state employee and you're using Pulse as well, it may be helpful if you turn your Pulse off because you may have a delay reaction or delay in response that happens with Pulse. So just a little tidbit there. It may be helpful.
All right, well, we can go ahead and get started. My name is Kirby Fye. I'm here with the department. Welcome everyone to the last statewide Planning and Policy Council meeting of 2021, if you can believe it. Just a few reminders, the meeting's being recorded per the Open Meetings Act. So if you have any questions when there's time during the meeting for questions, please state your name. It's helpful when capturing the minutes. And please also make sure your phone and or computer are muted if you're not speaking. It prevents all the feedback from coming through. I'm going to go ahead and hand it over to Albert Richardson, our statewide Planning and Policy Council Chair. And welcome. Thank you everyone for attending.
Good morning, everyone. First, I'd like to start off to welcome the guests and presenters and thank the members for their attendance today. Before we begin, I would like to remind the attendees to make sure that the phones are off and all computers are on mute. Phones are on mute during this meeting. Please only unmute your device when presenting or reporting. Please also turn off any video. If you have joined the meeting by both phone and computer, please be sure both devices are on mute unless speaking. Pursuant to TCA 8-44-108, statewide and regional planning and policy council meetings will be open to the public and held via electronic means, aka conference call. The meeting is being recorded, and the recording will be posted to the department's website within the next few days. Please join me in welcoming the following new members to the statewide Planning and Policy Council: Mr. Eric Landrich with the Metro Drug Coalition out of Knoxville, and Ms. Brenna Morris with the Tennessee Department of Education. I'd like to ask the members to introduce themselves, and if we have any members joining late, please make sure that Kirby is aware about utilizing the chat box feature. Also, ask attendees to use the chat box feature on the WebEx. If anyone has called in rather than join the call via computer, please email Kirby Fry at kirby.fry@tn.gov to let her know that you are in attendance during or after the meeting has ended. As a reminder to all members and guests, please remember the questions will be taken after the presentation. Please use the chat box feature to submit questions. Kirby will read them at the end of the presentation. If you do not have access to the chat box feature, please email Kirby with your questions. Now, before we officially begin, I would like to take a moment to inform everyone of the passing of Ms. Emma Long, a member of our statewide Planning and Policy Council. Ms. Long passed away unexpectedly in October. She did not only serve on the statewide Planning and Policy Council, but also Regional 6 Council and the statewide Adult Committee. For many years, even after she had retired from Pathways. Ms. Long was a wonderful person and an outstanding advocate for Tennessee. She will be greatly missed. If you would, please turn to your minutes. For the member of the council, please utilize the chat box feature to make a motion to approve the minutes. Please remember that only members can vote or make motions or second them.
I see a motion from Ricky and a second from Debbie Hillen.
We have a first and a second. All in favor?
Aye.
All opposed? Ayes have it. Motion is accepted. Would like have everyone had an opportunity to look at the meeting dates as they stand right now? For members of the council, please utilize the chat box feature to make a motion to approve the 2022 meeting dates. Only members again can vote. Make a second motion.
Looks like we have a motion from Gail in Region 3 and a second from Ricky Harris.
A first and a second. All in favor?
Aye.
You opposed? Ayes have it. Motion carried.
Albert, sorry to interrupt. Just one thing I want to add. So on that meeting calendar, we have the locations where we typically meet in person. We're going to continue to meet with the regional and statewide council chairs and vice chairs prior to each quarterly meetings, just to see where we are as far as the pandemic goes, because we want to keep everyone safe. So in the event that we need to meet virtually, everyone will be updated well ahead of time. And we'll also have that updated on the department website as well. So I just wanted you all to keep that in mind. We still may have a change in format going into 2022.
Thank you, Kirby. We're now waiting. Commissioner should be on about 10 minutes after. So we have about 2 minutes before that time. Kirby, do we have anybody new who has joined since we initially started?
Oh yeah, we have lots of individuals who have joined the call. It looks like we have 72 participants on the call so far. So great meeting, great meeting. And just a reminder, if you've joined via the phone, please email me at kirby.fye@tn.gov to let me know that you're on the call. That way I can mark you down as being present.
And maybe the new members, since we have a couple of minutes before the commissioner get on, would like to introduce themselves personally. Are you all guys on the line? Eric?
I know Brenna, she's with the Department of Education. She could not join the call this morning. She just sent me an email. Eric Landry, are you on the call?
Yes, I'm here.
Oh, hi, Eric. Here's one of our newest members.
Hello, everyone. My name is Eric Landry, certified CPRS. I am a faith-based coordinator for East Tennessee's Grand Division, serving 33 counties in East Tennessee with Monty Burks and Tennessee Department of Mental Health and Substance Abuse Services. Glad to be a part and looking forward to working with all of you.
Glad to have you, Eric. Eric, I noticed you got a couple of standing ovations. Okay. Okay, Kirby.
Also, Albert, if we have anyone while we're waiting on the commissioner on the call that may be new to participate on the council, that may not be a member but could be an invited guest. If you have not joined us before, maybe you can just wave or say hello and tell us who you are as well.
Can you all hear me?
Yes.
Hello? Yes,
Yes, we can.
I'm on my phone. This is Senator Massey. I was just letting you know I was on the call at least for a little bit while I'm transporting between meetings.
Thank you, Senator Massey. Always good to have you on the call, and thanks for joining us as well.
Welcome.
Anybody else?
Hi, my name's Chandler Haynes, and I serve with TDMHSAS as the regional advocate for West Tennessee, serving Region 6. I'm happy to be with you all.
Good morning, Chandler. Thank you for joining us today. Pleasure to have you here with us this morning. Did we miss anyone else? Okay, if not, and the commissioner, if she is not on the call yet, Albert, would you like to move into the regional council reports?
Yes, David, we'll do that, and when the commissioner arrives, we'll stop at that time. We'll start with reports. Regional Council 1.
Can you hear me? I'm not sure if you can. This is Tim Perry.
Yes, Mr. Barry, we can hear you.
All right, thank you. Sorry I'm about to join a little bit late. Region 1 met November the 9th with 26 in attendance. We had a presentation on mental health housing by Joey Smith. He shared a video and discussed the needs of and continued advocacy for mental health housing in the Northeast region. The Legislative Subcommittee for Region 1 convened a meeting prior to the council meeting. This subcommittee now consists of 8 members of Region 1. The subcommittee reviewed the budget presentations outlined from the Department, TennCare, and the Department of Children's Services. They recommended to the full council that the members consider individually reaching out to area legislators and thanking them for their support for behavioral health services and encouraging them to continue to advocate for these services in the future. A list. I'm sorry, I'm getting some feedback. Is that me or somebody else?
No, please, if you do not have your phones on mute at this time, please make sure your phone's on mute if you're not presenting or reporting. Thank you.
Again, a list of contact information for Region 1 legislators was provided to the council during this meeting, and the committee will be watching a couple of key pieces of legislation coming before the legislators this next year. Council still continuing to advocate for new members and actively engaging in the enrollment of members. The accomplishments, challenges, and plans for Region 1 were reviewed from the past year and discussed in regard to the beginning of the needs assessment process for the upcoming year. Kirby Fye was present and explained the needs assessment will be changing to allow additional needs to be included in the 22-23 needs assessment. Both adult and CNY subcommittees are currently in the process of discussing needs for Region 1 for the needs assessment. NAMI reported looking for new members to add to the Northeast region, and then Kirby presented and gave the department update. Region 1 Council will meet again in February, on February the 8th. And that's our report, Albert.
Okay, thank you. Region 2.
Good morning, everyone. Jan Cagle with Region 2. I am filling in for Mary Nell Osborne in October, and we have started, of course, going over the needs process. We had our several committees report. We did meet via Zoom. Ben, I may have chip in on this. This was an unexpected fill-in for Mary Nell, so you'll have to bear with me. We had reports from all our subcommittees. We are reforming our housing subcommittee, and we're pretty excited about being able to present more during this upcoming needs assessment. Kirby, am I missing anything?
No, I think you got it.
All right, thank you.
All right, thank you. Region 3.
Hi, I'm Deanna King with Region 3. We held our meeting October 14. We had close to 30 attendees virtually. We have been working on expanding our attendance and are working to increase our membership applicants from across our region instead of just Hamilton and Bradley counties. Virtual has really helped with that as well. We've also increased our participation from consumers and hope they will consider joining a committee. Child and adult committees are beginning to work on their needs assessments for the upcoming year. We currently have an open secretary position, and our next meeting is January 13 at 10 a.m.
Thank you. I see our distinguished commissioner has joined. Please help me in welcoming our Commissioner Marie Williams.
Thank you there, Mr. Chair. Richardson, I am totally fine going ahead and listening to the rest of the regional reports and then reporting out after those.
Okay.
Thank
that'll
you,
be
sir.
fine, Commissioner. Yes,
Absolutely.
sir. Yes, ma'am. All right. So Region 4.
Hey, this is Shara Biggs, Region 4 Chair, and I apologize. I've been speaking all morning already, so my voice is a little crackly. The Region 4 Council met in November virtually. Both the children's and adult subcommittees had previously met to start discussing the needs assessment. The adult subcommittee provided an update that they had decided to divide into two groups, one to focus on needs specific to mental health and one to focus on the needs specific to substance use. And within that, the 3-year plan was reviewed in order to compare which of those needs are currently being addressed and what gaps continue to exist. The Children's Subcommittee identified needs related to school-based services, homelessness, stress, and suicide. The budget hearing proposals were reviewed and updates regarding current legislative proposals were also provided. Data for the new Partners in Care pilot program was shared. And of those numbers of calls that have been received at that point in time, which I think was a 3-month time frame, only a small percentage of those calls have resulted in arrest, which is a huge success. The Partners in Care pilot is our co-response program between Davidson County Mobile Crisis and the Metro Nashville Police Department. The council was engaged in discussion around the currently selected needs, and feedback was solicited. During this discussion, the following additional needs were identified. Outreach to non-English speakers to include translation of materials, encouragement to seek out mental health services, as well as increased diversity in the workforce to represent those members of the community. Let's see, translation of materials for non-English speakers reviewed. Oh, that doesn't make any sense. I'm sorry, I'm trying to read my notes. Okay, the needs assessment, if I target. So we continued to discuss the needs assessment to identify the needs that the target wants to continue to prioritize. We also discussed addressing the needs of justice-involved individuals who are deemed not competent on misdemeanor charges, and what wraparound services and options are available for those folks, and also peer support from psychiatric hospitals to placement and outpatient services. So bridging that gap between discharge from psych hospital to group home placement and outpatient treatment. An update from the mayor's office was provided that included detection of substance use across the mental health continuum, and what does that currently look like. Also, there was discussion around a new form of methamphetamine that is currently being used, and information regarding this was provided to the council. The council also reviewed the Creative Homes Initiative funding that had been announced, and it was identified among the group that funding continues to not be available to support ongoing operational cost of mental health group homes. The group homes designated to provide housing and support for individuals with mental illness are lacking, specifically funding and financial support continues to be an issue for them. We have our next meeting on February 2nd, and both the adult and children's subcommittees are planning to meet prior to our full council meeting. That's all I've got. Thank you.
Thank you. Region 5.
Good morning. This is Debbie, and happy holidays. Our council met on November the 4th. We had 17 in attendance. We were and continue to try to work at our membership, especially on the consumer part of those in attendance. We actually had 2 presentations. One was from Kimberly Ladd with the Murray County Prevention Coalition about the evidence-based strategies that they're implementing at a community level. And the primary goal of that is to delay the first use of alcohol and other drugs. She also reported that there were 15 coalitions and they were growing. The next one was done by Monty Burks. And, you know, all those, you know, Monty's always a hoot and always a great presenter to talk about whatever you want Monty to talk about. And he did not disappoint. But we had specifically asked him to come and to talk with us about the recovery community as it was identified in Region 5. And so he sent us a link and for us to be able to go look. He talked about the free trainings that they were offering, also expanding to some trauma-informed care and ACEs, some more training with mental health first aid. So he talked about a lot of different things. He talked about the Lifeliners. He talked about the Tennessee Collegiate Recovery Initiative, since we do have MTSU in the middle of our community. We also talked, kind of reviewed the needs assessments from last year and began to talk about them for this coming year. We also are in need of a secretary. Secretary role had been filled by one of my staff members, and she went to another position. So we are still looking for a secretary. We talked about the big thing that I know Commissioner's probably going to talk about some of, and that was the workforce. The issues that we're facing with finding people in the community to work. I walked into one of the Target stores in one of the rural counties, and they were offering $17 an hour and giving a sign-on bonus. So workforce was one of the issues that we talked about, and we do know that the department, and thank you, is working on that. Kirby gave us updates on the 3-year plans, the mental health block grant plans, and also on the department's expanding On Track Tennessee. And that was actually the first time I had heard about that. And that's Tennessee's first episode psychosis initiative to 3 new counties. And one of those counties happened to be in our region. So we were anxious to hear more about that. We too talked about the Creative Homes initiatives and looking at was any of our agency member providers would be interested in that piece. The department gave the rest of their updates. We did ask everyone to be thinking about the needs assessments for mental health and for substance abuse, adults and children. And our next meeting will be February the 3rd. Happy holidays.
You, Region 6.
Good morning. This is Lynn Julian with Region 6. Can y'all hear me? I'm lagging today. Okay. Richard Barber could not be here. I'm the vice chair, so I'm filling in. We met on October the 12th. We had 14 attendees. We have a new secretary. Yay. Lori Hendon from Cary Counseling took over that and is doing a fantastic job. We had Kirby presented the department report. The Children's Committee is very active and is being led very well by Jerry Moore with TCCY and Megan Gaylord with Youth Villages. They're working on field days in both the north and south parts of our region for March of 22. They're developing an online magazine and blog to focus on mental health, and they're developing a family guide to outside. The legislative committee, which has consisted of me, and I think we all know I need some help in that area, is finally getting a new member. Yay. Julianne Stone from Scarlet Rope will be joining me in January. And the adult committee continues to meet regularly. We had a presentation from Leah Gray at NAMI on CIT in our region, and that's very effective, and we're very appreciative of that. And we discussed prepping for the needs assessment and the housing block grants, and that's it.
All right, thank you. Region 7.
Hi, yes, happy holidays. I'm Mary Neal. I'm filling in. I'm our vice chair. Our chair is home with a sick baby today. We met on October 26th at 11:30. We had 18 in attendance that day. Kirby gave our updates for the state, and then we opened it up to announcements and networking. There were several conferences that were coming up in November, the Lakeside Ethics Conference, a mental health law workshop, and so talked about registration for people that were interested in that. Kirby also gave updates on the needs assessment. So we talked about some plans surrounding that. We were supposed to have a presentation that day, but they needed to reschedule, and so we'll be at our January meeting. And it was the regional housing facilitator for the Creating Homes initiative here in Region 7. And we will be meeting again on January 25th in a hybrid fashion, Microsoft Teams and at the Church Health Center at 11:30.
Okay, thank you. So the adult committee.
Hello, this one I'm prepared for. So Candace has asked me to do the report for the adult subcommittee. And Ginger is also out. We met on October 13th, and we had a special presentation by Cherished Moms. It's a nonprofit founded by Christina Delaney about 3 years ago to promote awareness, education, and support for perinatal mood disorders to moms, families, healthcare professionals, and the community. That was much appreciated. And of course, as always, we started working on the needs assessment. We reviewed what had already been submitted and discussed possibilities for the upcoming needs assessment. And then our next meeting is planned for January 12th. And we were asked to suggest meeting topics to either Ginger, Candace, or Kirby. Thank you.
Okay, I'm sorry. Thank you. Children Committee.
Good morning and happy holidays. I have a quick update for you all. Our committee met. We had a presentation by Ms. Kathy Rogers from Tennessee Voices where she talked about the Teen Connect parenting group. She's working with DCS with children in foster care, but those who are at risk of being removed from their home, especially in the older youth category, so 15 to 18 or 17. She told us a little bit about that training and how it works and the success of that training. And then we turned our attention to our 2022 needs assessment. Like you all did in the adult committee, we reviewed what we had submitted last year and celebrated in some ways of the success of, having met some of those needs and seeing some new things happen that will address some of those needs going forward. And then we looked at what's happening now with children's mental health And we turned our attention to something you all may have seen. It was a little bit ago, but the American Academy of Pediatrics and American Academy of Child and Adolescent Psychiatry and the Children's Hospital Association declared a national emergency in children's mental health. And what I will tell you is since we've met, I'm sure you all have seen, but if you haven't, I'm going to share a link to it in the chat. There was a release from the Surgeon General's office on youth mental health. And it's a really nice report, and I would highly encourage you to look at it. One of the things on the list, lots of great tips for youth and parents and people in the field, but in the section on what can we be doing, it says be a voice for mental health in your community. So thank you to all of you who are doing that each and every day, because that's what we've got to do to get it done. We look forward to continued participation from the regional committees. It's so great to have you guys jumping on the statewide call and providing that input. And again, happy holidays, happy New Year, everybody.
Thank you. Consumer Advisory Board.
Thank you, Albert. Good morning, everyone. I'm Dina Savanos. I'm the CAB chair. The Consumer Advisory Board meets the first Friday of each month virtually, and we'd like to report that in September, we had Christina Dulaney as our resource speaker. She's the founder of Cherish Moms, supporting maternal mental health. And we didn't have a recovery story speaker as usual that month. They couldn't make it at the last minute. So we opened the floor for sharing about maternal mental health. And many shared. Some stated that they were sharing for the first time on this very important topic. So in October, we continued the conversation with Rachel Hill and Madeline Ross of the Mother's Love as our resource speakers. And we had Jakarta Suggs, who inspired us with her recovery story. She's a consumer housing specialist for behavioral health initiatives out in Region 7. And in November, we had Lucius Irvin, who is the founder of Mindful Recovery Coach, as our resource speaker, and Edith Allen, who also inspired us with her recovery story. She's the founder and CEO of Diamonds in the Rough Substance Abuse Ministry. And in December, we didn't have a resource speaker because we decided to go ahead and start focusing on the needs assessment and receiving regional policy and planning updates again. Instead, we did have a recovery story speaker, very inspiring Angela Easterling of Live Fully Wellness and AccuDetox. So we continue in our meetings each month to set aside time to share wellness tips and just support one another, asking questions such as what brings you joy and what brings you peace and what keeps you strong in your recovery. And we also enjoy monthly updates from the Young Adult Leadership Council, the CPRS program, My Health, My Choice, My Life, my initiative, and the Tennessee Association of Peer Specialists, as well as conference planning and other business matters. The Zoom link can always be found on the tn.gov webpage for the Consumer Advisory Board. And in October, we had our 11th annual CPRS conference for 2021 virtually. It was via Zoom. And our theme was Rolling with Resiliency across the state of Tennessee. We had over 300 attendees, and the reviews were the strongest that they've ever been. And all the sessions may be viewed at the tn.gov website. And I can put that in the chat in just a moment if you're interested in going back and maybe viewing the ones you didn't see or watching them there. So planning for next year's conference will begin already next month. And you can let me know, please, if you're interested, or you can let Michelle Webster know in participating with that. And we are planning on an in-person conference next year in October. And finally, we have quite a few membership openings at this time. We have 2 in Region 2, 1 in Region 3, 2 in Region 4, 2 in Region 5. So if you or someone you know is interested in becoming a member, joining us for a monthly meeting, or if you'd just like more information about the CAB, you can contact me at any time, Dina Savanos at csavanos@tamho.org. or you can contact Kathy Haley or Michelle Webster. And our next meeting is actually on the second Friday of January, January the 14th, due to the holiday. That's 1 month from today. So please join us if you can. That's from 9 a.m. to 11 a.m. Central Time. And that's it. Thank you.
Okay, planning and budget, and then after that, we'll bring on a long-awaited commissioner, and if that's okay.
Mhm. Yes, sir.
All right, planning and budget.
Sure. Good morning, all. Hey, the Planning and Budget Committee was able to meet last week on Thursday, and it was a brief but lively meeting as we got to have a opportunity to dive in on something I know y'all have not read, and it's the 3-year plan and the timely reports that we get on the 3-year plan. And kudos, hats off to the planning department team for being able to dissect both the August report and then explain the workings of the 3-year plan. It's actually kind of exciting if you're a policy or planning nerd like me and Debbie Hillen. But I found some interesting information in both reports. The most interesting is, and I'm sure the commissioner is going to be telling us about additions to the budget, that sort of thing over the next few months. But the 3-year plan is actually a living document, so that when changes to the department funded continuum are added, then they get into the 3-year plan, and then the reporting starts to happen on that. So it's really kind of fun and neat to see and follow along as those happen. And I got to give a shout out to Kirby and Kurt and Avis for their ability to keep it all straight, because there's a lot of things that have been added in recent years and are in the current 3-year plan and in year 2 that was just reported in August. So thank you. It was a great meeting. And I would be remiss if I did not remind everybody the needs assessment process needs to be started if you haven't already done so. And the needs assessment recommendations are due April 1st, I believe. Thank you, Albert.
Thank you, Ben. Now we'll bring on our commissioner, Commissioner Williams.
Thank you so much, Albert. I really, really appreciate your leadership, and would like to add to what Ben said. It's very rare that you have a 3-year plan that lives and breathes and is totally updated and reviewed on a regular basis. Ben's very right about this. It doesn't sit on a shelf. It's an integral part to what our department does every day. And as you all know, that is informed by you. And again, cannot thank our team enough. Ben, you're right. Kirby, Avis, and Kurt do a fantastic job at leading that effort and keeping us on track, which we really appreciate. The other thing that I want to say is Dinah, I think that's how you say your name, the woman who gave out the consumer reports or consumer affairs report. I'd really like to thank you for your thoughts around joy and peace. What brings you joy? What brings you peace? Because we all know, as I believe Senator Massey would agree to, it's my understanding she's on here, that this last year has not had a lot of peace and joy. The last 2 years have been filled with COVID chaos and tornadic tantrums. And truly, that reminder of joy and peace is really important, especially as we look at the last year and where we will head in this new year. Albert, I want to thank you, as always, for your great leadership of this group. It's always a pleasure to come and look at everybody. It's great to see everybody's faces that are on here by picture. So a lot of what's been brought up that I would speak about is what I'm speaking about. Our team has done a fantastic job of preparing a budget that is the largest request budget in the history of the department. And we are very grateful for the opportunity that Governor Lee and F&A Commissioner Ely gave us to move this budget forward in our request. As you know, the governor will be deciding what he will include in that budget, and we'll know about that during his State of the State. And the other thing that you know is that these were items that were informed directly by you, by the regional councils that come back and tell us what they believe the top needs are. And then we take those and we do an Excel spreadsheet looking at where we're at related to data. As you know, we're very focused on data, related to data as to what we should do. So let me go over those, and it would be great, Avis and Kurt, if we could maybe make sure this list, I know I sent out a letter, but I just want to make sure everybody gets a copy of this list because it's truly wonderful. First one is a cost of living adjustment. This is to provide a 20% cost of living adjustment to the department's state-funded, community-based behavioral health providers. And we did that 20%, looking at a 2% increase over the last 10 years. That amount is $35,989,300. I am so excited about this request. And not only am I excited about our request for this, I'm excited about TennCare's request for this funding as well. We acted before the report was done because Stephen and I took a look at what the preliminary discussions were and said, hey, let's put something in our budget this year prior to any report coming out. So wanted y'all to know that. Substance abuse clinical treatment. As you know, we continue to lag when you compare our graphs with mental health gap for uninsured, and then you look at substance use uninsured. Our substance use uninsured is higher than our mental health uninsured. That's pre-pandemic. So stay tuned. We will be updating our numbers because we know it's going to be higher for both. But we have asked for $6 million to actually increase that continuum of care treatment services across our state and to fund our providers to expand those services. Our addiction recovery program, we asked for wraparound dollars in the amount of $1 million in funds. That $1 million in funds would allow us to do those regular wraparound outside of direct treatment. As you understand, Albert, as we fund you as one of our agencies, you need wraparound once a person gets out of direct treatment. And that again is $1 million. Then if you look at our crisis continuum, we are actually wanting to locate 3 new crisis centers and across this state. We're looking at where we have need and also don't have access. So Northwest Tennessee, looking at potentially Clarksville, and also looking at Montgomery in addition to Murfreesboro, south of Davidson County, and also looking at a place in, as I said, Northwest Tennessee. That total funding is $25,799,900. In addition, we'd like to have MPA pre-screening agents. As you know, they do the work in our community to assess people that are in need of inpatient hospitalization. And we would like to also put those individuals in our hospitals where we have the highest demand, similar to what we're doing with the Tennessee Recovery Navigators that has been such a success of connecting people. As you know, we've got over 70% of people that are seen with a Tennessee Recovery Navigator in a hospital actually go in to treatment. That's pretty amazing. Then we're asking for $26,520,000 for substance use residential treatment infrastructure expansion. We know that all of our substance abuse providers have let us know that if they had more space to do detox, to do residential, that they could provide more services to more people. So that's an ability to increase that infrastructure. The Creating Jobs Initiative funds that were being discussed earlier, could not be more happy about this. This will allow us to draw down through the Department of Human Services, who have been a wonderful partner, $3.3 million. So our request of $900,000 allows us to leverage $3.3 million. And that will allow us to hire up to 37 new community employees that will be hired through the community-based agencies that respond to the AOF. And as we know, employment really helps in recovery. And this is one of the high evidence-based practices that we utilize with that. And Mark Liverman, I cannot say enough about him. I believe he's on here. He's done yeoman's work in leading this. Thank you, Mark. Our IT support services, we did an analysis. Again, we look at data, did an analysis to see how we compared in staffing with our IT support. You guys know we operate a lot of homemade in-house based web technology. The safety net, see some of you shaking your head, safety net, the crisis tracker, our consumer affairs office tracker. And we found out that we are the lowest staffed per people overseen and actual platforms overseen, lowest staffed of anybody in the state. So we had a really good argument that we needed to be able to hire more IT staff. That number is 520,700. And then finally, very, very hopeful about the rebuild of Moccasin Bend Mental Health Institute. That is in our budget this year. I know that the funds are being considered for that, one-time funds out of the governor's ARP dollars that he's looking at with senators and representatives that have a committee that look at that. But we did go ahead and ask for state dollars in the event that's not made an ARP project. And just so you know, for that, that's $276,520,000 for a total of $383,249,900 for our safety net programs across the state. Again, could not be more happy about this request. I will open it up, Albert, for any questions or comments before I move on to an update that I was requested to give on the 988 plan.
So Commissioner, I will just start with an applause. This has never been done before. And I see members clapping, and you probably hear some hallelujahs if they wasn't on mute. But
I see you, Ricky.
I'll say hallelujah.
That's all right. This is something that never has been done before.
Yeah.
I'm excited, as all the members are. We salute you and your team who have, went all the way with this, and we're extremely proud of you guys. Thanks. And I'll open it for a few members to ask questions if they need to now.
Thanks, Commissioner. This is a tremendous budget and so thoughtful. I want to say that I'm Mary Nell. I'm with Peninsula in Region 2. And one of my questions was just to clarify the crisis centers. Can you review those locations?
Absolutely. I'll review those locations. We're looking at Northwest Tennessee. And so that would be outside of the Memphis-Jackson area, because those are the only two that we have in that realm. We're looking at potentially Clarksville or Murfreesboro, still reviewing the data on those. And we're looking at, again, somewhere south of Davidson, which may be Murfreesboro or another location. Does that help, Mary Nell? Thank you. Thanks for your question.
Commissioner, this is Debbie. I sent you a thing in the chat box, but
Okay.
For as long as I've been on the council, I've been doing the needs assessment, and the one need that is redundant every year is crisis services, crisis unit for Region 5. So, excuse me, this is great news for us. So, took a while, but we got you. We finally got you where we needed you to be, and we thank you for those considerations for Region 5.
Absolutely. And Debbie, let me say something about why it took a while, just so people know. You've got to be able to prove that you need what you need. So if you have availability in CSUs and we're not using those, then we get pushback appropriately so from FNA as well as the legislature. Like, why do you want to do this? Can you prove that what you're doing is helping now? And so for everybody on here that wonders why we wait for certain things, please know it's not because we don't believe in them. We believe in them, but we also have to have data to prove the outcome and that there's that need. But Debbie, I really appreciate you. You've been a great supporter of this process. And so we're hoping it's going to really help in your region.
We hope so too. Thank you very much, Commissioner.
Absolutely.
Hey, Commissioner, this is Ben.
Hey, Ben.
How are you?
I'm good. Thank you.
Good. Hey, I wish you would take just a minute if you could and explore a little bit more on the two prongs of your workforce enhancement recommendations. I'm very appreciative of your recommendation of the COLA increase for the grant funded agencies, but there's another prong that you didn't mention this morning. So I wish
You're right. Yeah, you're absolutely right. It's the Tennessee Behavioral Health Workforce. It's $10 million that we asked for. I'm sorry, I just passed by that and went straight to Creating Jobs Initiative.
You were just too excited.
I mean, I am. It's like you're reading off one thing after another. But thank you, Ben. I apologize that I missed that. That's the second prong. And I'll tell you, I'd like to ask Matt Yancey. He sent me the verbiage for this, but y'all, Matt really is the person in combination with TennCare that led this particular request. And Matt, I'd like you to talk to this. You really did yeoman's work in putting it together. So I'll turn that over to Matt to respond to.
Yes, ma'am. Well, good morning. Hey, Ben.
Yes, sir.
Good to see you. Yeah, so we have asked for $10 million in recurring state funds to do three things. And these three things were really highlighted from the work group that TennCare and the department facilitated over the summer, looking at the public behavioral health workforce and what strategies can be done to impact the current workforce in a positive way, and what we can do as a state to better shore up pipeline planning for folks that we know need to come into the workforce. So, Ben, there are three things that the $10 million will go towards if approved. One of which is creating an internship portal, which our vision is that each agency that we contract with would be connected to this portal to highlight internship opportunities within their agencies. On the other end of that portal are all of our partners in education, colleges and universities who are trying to connect their students to internships and practicum sites. And behind all of this are dollars that would actually go to support paid internships. I think people on the work group from academia really stressed upon, the most successful internships are those that are paid internships as it relates to people graduating and wanting to stay with that agency post-graduation. So that's what that bucket is for. The second area of the $10 million and is a scholarship program. A lot of folks are leaving colleges saddled with student loan debt that often eclipses the starting salaries that they have with the jobs that they graduate to. And one of the things that we're going to do with this is invest in people who want to get relevant degrees to the public behavioral health system, whether that be counseling or social work or psychology. And we're going to pay for those college experiences up front so that people don't incur any cost. And the expectation is that they commit post-graduation to work with one of your agencies for the equivalent amount of time. I personally experienced something like this in my prior state when I worked in child welfare. The state came to me and said, would you like to get a degree in social work? And I said, a master's degree. And I said, absolutely. And they said, oh, well, my question was, well, can I go to the University of Georgia? And they said, yeah. I said, sign me up. So, I graduated with a degree in social work and had to commit 2 years back to the state. And gosh, that's 16 years ago, and I'm still working in state government. So I think these things do work. And then the third prong, and let me say to that point too, Ben, it's not just college stipends. We've also thought through with the current workforce who we know need more training and exposure to evidence-based programs and modalities. We also know there's a cost borne out of that when it comes to getting people trained, certified, supervised. If you're sending clinicians away for training, that takes them out of the clinic. How do you resolve for that issue? So part of our vision too is to help support people who are currently working for your agencies become trained and certified in things like trauma-focused CBT or DBT or whatever it may be. We're also looking to do that. And then last but not least, Ben, is a sign-on bonus component to this. I think some agencies are already offering sign-on bonuses. I think those same agencies are struggling when it comes to competing with for-profit entities who can often provide a higher sign-on bonus. So some of this $10 million would go towards that. But the overarching theme is that we're wanting to shore up current challenges within the workforce that is already in place by supporting them better, but also thinking more future forward about what we can do to bring more people into this field. I hope that helps.
Very nice. Thank you.
Thank you so much. The other thing I'd like to say, do we have anybody from TAMHO on here today? I'm sorry, I'm having a hard time seeing who's on here. Anyone's from TAMHO on here, would you speak up? Okay, we don't. What I wanted to say is Elliott Pinley with the Behavioral Health Foundation, who is on here, worked with TAMHO on a very important report, which we looked at as a group when we were trying to determine best next steps for our workforce report. And I just wanted to thank him and TAMHO for what they did. Obviously, when you're putting together information, we also looked at their prior report with MTSU, the economic and financial fallout related to workforce issues. But when you guys see the whole report, you're going to see, I mean, we pulled from every resource you could pull from to inform our next steps. And I know that we've met with the executive committee, and I think the executive committee was pleased with what we've got. So please take a moment to take a look at that report. As I said, we're very, very proud of what we're recommending and very hopeful that the legislature sees this as a need and that the governor and his team see it as well. I would stop to see if Senator Massey, if you're still on here, Senator Massey, anything you want to speak to related to the budget or the report? Alrighty, so not hearing that from her, I'll go back, Albert, to you. Anybody else that has a comment or a question about what we've just gone over? Okay.
Yeah, I see none.
Do what?
I see none, Commissioner.
All right, good, good. Albert, I'm going to go to the next thing that I was asked to update you on, which is the 988 plan. And I'm just going to bottom line this because we have talked to the group about this. We've had multiple meetings, multiple stakeholders. At the end of the day, our state was the first that said we're not going to pursue legislation because we don't have data to inform the request. I want you to know that most states followed suit. Most states have decided not to pursue legislation around 988 this first year. I also want you to know that this work group did say we're going to continue to meet to look at how 988 is implemented, what the phone call actual increase is. Can the centers that we actually contract with handle that increase? And we will be, again, on top of this as we move forward. So we will continue to update you guys on that. Any questions about 988 and where we are on that? Okay.
Wait a minute, Commissioner, I do have a question.
All right, Ben.
I know we started this fall with funding to the 6 NSPL sites to expand their staffing so we could actually determine, are they able to meet the demands, and does the increased staffing eliminate some of the lost calls or the rolled calls to other states? So I know we started that in really November. They had their staffing brought up to speed. Can we expect in the February meeting an update on how well that increased staffing is meeting our needs?
Absolutely.
Good. Thank you, ma'am.
If Avis will make a note for us to come back and speak to that, just so we don't forget it, we will for sure let you know where we're at on that. Thanks for the request.
Perfect. Thank you, ma'am.
Hi, Commissioner. This is Elisa with NAMI, Tennessee. Hi. I just wanted to get some clarification on something you just said. Did I understand correctly that you're saying that most states did not pursue legislation around 988?
Yes, you understood me correctly. And the reason they're not is there's not data. Most states that are Republican-led do not want to ask for funding without data to support the funding. So they're sort of on a wait and see. If you look at their report, they've got a state national map where they show who's pursued legislation and who's actually waiting to see what happens. So that's as of today.
Okay, thanks. And the reason I'm asking is because NAMI nationally is part of a national coalition on this issue, and we're tracking some legislation. We're seeing more policy-related things in terms of legislation, but yes, certainly the fee part of the discussion is something that many states are not embracing at this time, and so we're watching this as well.
Yeah, and thank you for that. There are policy points that are being discussed. One of the things in our state that I know that you're aware of is we already have the infrastructure that many states are looking at putting together. We already have the policies, the procedures, the regulations, the support for crisis centers across our state, which a lot of this funding is supposed to go to uphold. You need a service when you get the call. So I have been reading all of the work you guys have been doing in tandem with the group, and really appreciate your support of what we can do better for Tennesseans in crisis. So thank you for that. Any other questions or? Okay, moving on to the next thing. Again, looking at what you all said you needed, we have actually have the following AOFs. I believe, Ben, you're the one that asked about this. We've released Tennessee Resiliency Project, the Residential Recovery Courts, CHI 3.0, CHI 2.0, Creating Affordable Housing, and Intensive Long-Term Support AOFs. want to give you an update on the Tennessee Resiliency Awards. Very excited. As you guys know, this is funding that goes to the local communities to work in tandem with the school systems to develop the most collaborative approach to responding to behavioral health needs in those areas. And so I'll go through real quickly who got the award.
Commissioner, you're getting muffled out. Can everybody please put their phones or their computers on mute while the commissioners speak? Thanks.
Thank you, Albert. Can you hear me okay now? Great. So I'm talking about the Tennessee Resiliency Project awardees that we just released on Friday. In Region 1, Frontier Health has received an award of $423,000. They will expand school-based services. In Region 2, Helen Ross McNabb received $1.1 million. They will create 3 crisis response teams that will be embedded in child-serving care systems. Region 3, Volunteer Behavioral Health, received $901,000. They will be working with expansion of school-based health services through expanding school-based liaisons. Region 4, Tennessee Voices, $623,407. They will be doing a child care consultation expansion and adding 2 early childhood specialists and integrating 2 family support specialists into their services and training for families. Region 5, Volunteer Behavioral Health, $593,860. That will go towards the expansion of school-based behavioral health services through additional behavioral health liaisons and project basic staff. Then grantee 2 for that region is going to be the Prevention Coalition for Success in the amount of $200,000. They're adding services for the family prevention program there. Another grantee there is Youth Villages in the amount of $426,278. They're increasing enhanced crisis coordination. A 4th grantee is Tennessee Voices for that area. They're also expanding with $608,869 child care consultation and other services. In Region 6, we have Pathways, who is receiving $499,840, promoting early childhood mental health by building on already established consulting services. And then finally, Tennessee Voices received for Region 7 $1.15 million. And that will be to expand child care consultation as well as 3 family childhood specialists and 3 family support specialists. You guys have very much advocated over the years for expansion of child services. I know Carrie Virgo's beaming with joy. I see your face. Carrie, anything you want to add to that as this really comes under your shop?
Thank you, Commissioner. We are just so incredibly excited to get to see another $6.5 million going out to the community related to kids services. And so there's really, you guys all did such wonderful proposals. It was interesting to see the creativity. So we truly appreciate everybody who applied and are very excited to get moving with all of you who were awarded. So thank you.
Absolutely. I'm going to continue with where we're at on the AOFs and then ask for any questions at the end, if that's okay, Albert. Our residential recovery courts AOF is being reissued. Please be on the lookout for this. We are wanting to establish 2 residential recovery courts, one in West Tennessee, one in East Tennessee. We're reissuing it with the ability to have more days to review and respond, as well as to be able to include a letter of intent for a smaller agency that may need a bank to see that there's a letter of intent to fund them if they're awarded that. So be on the lookout for that. That'll be a 90-day reissue. The CHI 3.0 proposals, which are for the Creating Homes Initiative, and the 2.0 proposals. Actually, the CHI 3.0, which looks at criminal justice housing, they were due yesterday. But on the CHI 2.0, we received those, and those are related to substance use housing. And we're reviewing and scoring those. And then the ILFs and the other housing AOFs, which are in the process of being released and being reviewed and scored. So any questions about that?
Hey, Commissioner.
Yes. Yes.
I just certainly you recognizing Carrie is appropriate on that Tennessee Resiliency Project, but I also wanted to recognize our housing director, Nehru Gobin, on all of these housing projects. Yeah, I think as the commissioner referenced earlier, when we look at funding requests and funding priorities, we start with the feedback of our planning and policy councils. And I know housing has been and continues to be a priority for people across this state. And Nehru and his team, especially over the past year, have just done a really amazing job getting multiple funding opportunities out the door. And just want to say thanks to Nehru for all his efforts. He's working around the clock. He does an exceptional job. And if anybody needs some R&R over Christmas, it's Nehru Gobin. So anyway, just wanted to say that.
Matt, thank you so much. Nehru, I didn't see you. I saw Mark, but I didn't see you. Hey, thank you for all that you're doing. Really, you're absolutely right. I would put Mark and Nehru both in high need of rest and relaxation. And what's really good is I see one of their new staff members, our staff members on here, Stephanie Cooper. Stephanie, I don't know if you need R&R, but maybe you could... Maybe you could, I don't know, fill in. Stephanie, it's awesome to have you on our team. I haven't gotten to meet you as a new member of our team, but really, really glad that you're here and that you're helping us. So, Matt, thank you for that. The next questions that I had, Tim Perry, Region 1, you asked about the Creating Jobs Initiative. And where we're at on that. I believe what we just went over should help with that. If you've got further questions, let me know. Then we got a question from Ben Harrington related to workforce development work group plan. And I appreciate that. I think, Ben, we went through that for you. I hope that covers everything. And guys, that's it for the questions and information that I was asked to respond to. At this point, Albert, I just want to wish everyone a wonderful, wonderful, wonderful holiday season. I hope that everyone gets the opportunity to reflect, relax, and re-energize as we go into this new year. And Albert, with that, I'll open it up for any questions for any of our team.
Commissioner, before you go there, I'm disappointed. I got no song today.
Well,
I always look for a song from you.
All right. I'm going to let everybody else do any questions or comments they got. I've got a good song. I've been listening lately to Christmas music from all kinds of people. But then this morning, Jackson Browne showed up. And I'll play a little Jackson Browne before I get off, Albert. But I want to make sure that we respond to any important questions anybody's got. Thank you, Debbie.
Okay. Do any members have questions for the commission? Commissioner, I see none.
Yes. All righty. So This is a song that is not very well known, but it is beautiful. Talks about angels. It's Too Many Angels. I don't have my boombox up here, Debbie Hillen, so I'll play just a little first part of it for y'all. If you get a chance to look up the words, this is a great Jackson Brown song. Can you
Sounds
hear
great,
it?
Commissioner. We can't.
Not at all. Sorry, guys. Too many
You're gonna
angels.
have to sing it. You're gonna have
Hey,
to sing it.
I'm not gonna sing. I'm not in a singing mood today. It's not. It's not. I will sing. I wish you a Merry Christmas. I wish you a Merry Christmas. I wish you a Merry Christmas and a Happy New Year, as well as Happy Holidays for those that are on here. So again, I'm grateful to serve. I'm grateful to serve with our incredible team. I can't say enough about the department team. I tell y'all this all the time. Top notch, as are you as providers. So thank you, Albert. It's back to you, sir.
Thank you, Commissioner, and we thank you for the Christmas gift that you and your team presented us today, and been working on for the longest. Thanks. We really appreciate you guys. It's my job to give you a executive committee report. Now that's hard to do behind what you've already been told because you've been given all the information. So I'll just tell you that the executive committee met on December 1st in collaboration with TennCare. The department created a Tennessee Public Behavioral Health Workforce work group in June 2021. The work group was tasked with producing a report proposing short-term and long-term strategies. The focus on recruitment and retention opportunities that can be implemented by local behavioral health providers, colleges, universities, and various state, Tennessee state government departments. During the meeting, Commissioner Williams and Deputy Commissioner Yancey provided updates to committee members on the outcomes of the work group. The strategies developed by the work group helped form the department's budget proposed request regarding workforce development presented to Governor Lee on November the 1st, 2021. A recording of the meeting can be found on the Tennessee Department work website. Now, in saying that, you have heard the report. You have went through the planting of seeds, and now we're looking at the harvest. And for that, we all celebrate, right? And so, just please help me, join me in thanking Commissioner Williams, Deputy Commissioner Yancey, and the whole team for all that they did. Really appreciate you, Commissioner, and we appreciate the whole team. Okay. Do you have anything that you need to say, Father Commissioner?
No, sir. Just thank you. We're blessed in this state. Thank you so much.
All right. Thank you. With that, we will move on to the school-based behavioral health liaison expansion. Carrie Virgo, Director, Office of Children, Young Adults, and Family, Tennessee Department of Mental Health, Substance Abuse Division of Mental Health Services.
Hello, everyone, and thank you again. It's like super exciting. I'm still riding off that high of Commissioner talking about the Resiliency Project. It's been a labor of love, y'all. So now I'm excited to get to talk a little bit about school-based behavioral health liaisons. I am filling in today for our wonderful director, Kayla Mumphrey, who couldn't be with us today, but I'm going to do my best. So we're going to see if I can share this well. Somebody give me a nod if you can see that screen. All right, beautiful. All right, so wanted to give you just a very, very brief overview of the School-Based Behavioral Health Liaison Program. And we've got a great presentation, so I'm gonna make this quick. So really here, what we wanted to show you was that since 2006, we have made some pretty good strides in terms of school-based behavioral health liaisons. In 2006, we started with 5 agencies serving 13 counties. That increased, there's been a little bit of funding increase, and in 2019, we were able to expand to 12 agencies serving 36 counties and 84 plus schools. And then in our most recent appropriation in 2021, we were able to increase to all 95 counties serving 150 plus schools. And as Commissioner alluded to a little bit earlier, some of the awardees with the Tennessee Resiliency Project are actually focused on school-based services as well, which is incredibly exciting. So we just wanted to give you a little bit of the trajectory on how we have done in terms of funding over the years. It continues to rise, which is a beautiful thing when you consider what Ricky shared with us earlier regarding the Surgeon General's report about the importance of youth mental health and making sure that we are providing all the services and supports we can. One thing I did want to mention in a effort with the Department of Education, we did hear a need, and that need was that educators were having some emotional support concerns as well. And so what we were able to do was increase the capacity of the COVID-19 emotional support line that includes educators in an effort to support that school staff and faculty who are experiencing feelings of stress, anxiety, sadness, depression related to work. So that was very exciting. And just as a reminder, we do utilize the MTSS framework, the multi-tiered systems of supports framework with our school-based services. This was introduced by the Department of Education in 2018. The MTSS framework provides guidance for academics as well as non-academic supports for students. And in 2020, the department implemented the use of the MTSS framework for non-academic supports shown here above. And so that's my real brief overview. And now I have the distinct privilege to introduce Ms. Lindsay Stone, who is going to speak with us about their program. This is quite a list here, Lindsay. It makes me a little tired thinking about what you do all day long. Lindsay serves as the director of the Children and Youth Mental Health Programming at the McNabb Center. She currently oversees children's mental health programming in Knox and surrounding counties in East Tennessee. Lindsay began working at McNabb in 2005, where she worked in school-based services alongside therapeutic classrooms for children with emotional disturbances, providing trauma and grief counseling to teachers and students, and in intensive community-based case management. Since then, she oversees the center's largest school-based programming division, 2 outpatient children, youth, and young adult clinics, Tennessee HealthLink services, intensive case management Continuum, children's behavioral health safety net programming, first episode psychosis programming, a crisis family walk-in center, and she will be overseeing Tennessee's first children's crisis stabilization unit to open in 2022. Lindsay holds a bachelor's of arts in psychology from Lee University and a master's in arts in mental health counseling from Argosy University. And with that, I'm going to turn it over to you, Lindsay, and I will be happy to forward your slides. Just give me a signal.
Thank you, Carrie. Good to be with everybody today. As Carrie said, I have a lot of variety in the programming that I get to oversee, but school-based is where I started my career. It's been a part of my career the whole time, so it's my privilege to talk about our school-based behavioral health liaison services with the department today. You're welcome to go forward, Carrie. McNabb has been, several of you might know, McNabb Center has had a long history with school-based services since 1992, and we've had lots of different expansions of different types of services. But one thing that we've seen such a great benefit is when the department extended that funding to all 95 counties and allowed school districts that didn't have access to mental health services from a local community mental health agency that specializes in that to come in and support them. That has been one of the areas that we focused on over the past year, and the piece of school-based that I'm going to highlight with us today as well. For those of you that aren't as familiar with our school-based liaison services, just to expand on what Carrie had said, we provide master's level liaison clinicians to local school districts. And I'm sure, as most of you on this call know, we don't meet many school districts that disagree that there's mental health needs within their schools. Usually it's, we know the need is there, but we don't have the funding. We don't know how to contract with staff. Our staff are not equipped to do that. And so providing community mental health agencies that are equipped with that trauma-informed training in the school systems allow us to have that collaboration, and we have seen a great success with that. And I'm going to talk about some of those successes and some of the challenges that we've seen over the last year with the pandemic as well. Areas that we focus on, and they're not limited to this because we obviously see a variety of needs within every school, and we take every school culture as an individualized process. But our master's level staff are embedded within that school system, and we do individual, family, and group therapy. Most of our liaisons carry caseloads to provide what Carrie referenced, that tier 3 service, which are kind of direct services. But what we also do to reach a larger number of students and staff from that global perspective is to provide consultation and psychoeducation to students, to staff, around key topics, ACEs, trauma-informed practices, childhood mental health, stress management, which we know has been a greater need over the past year than ever before, substance abuse. But we provide that consultation in a very organic way within the schools because our staff are embedded. I always say that one of the greatest successes is when you can walk in and not know which is the community mental health provider staff and which is the school staff, because they're so integrated and working alongside of each other. But we provide that trauma-informed culture for the staff as well. Carrie, you can move forward. For those of you that actually are on video and can see this graphic, if not, I'll explain it. This is one of the graphics that I share when I do a lot of school-based training, because more so than ever, we know that students are carrying in things that we need to be aware of as they come in. So there's a picture of a child carrying suitcases that outline hunger and sickness and homelessness, and a staff on the sidelines and another student looking at him kind of surprised as far as, why are you carrying in all that baggage? The reason why I am so passionate about school-based services is because between the home and the school, those are the two primary environments of a child. And as adults that support those students, we need to not be on the sidelines. We need to be in the process of making sure that we're addressing those needs when the students come in. And we need other students to not be surprised that we're addressing those things when they come in, that when they have needs that affect their educational environment and that they take home from the school or from the home into the school and education environment.
Need to text Joel and that.
That we address those needs within their primary support environment. So this is a collaborative process and not anything that any of us want to stand on the sidelines for, that we want to be in conjunction with those needs within that school environment. You can go ahead. So the impact of expansion. So McNabb has expanded by 9 counties just within the past year. So for those of you that can see, you can see our counties listed there, but we're currently in Blount, Cock, Hamilton, Knox, Loudoun, Claiborne, Granger, Hamlin, Union, Bradley, Meigs, McMinn, Jefferson, and Sevier, and have great relationships with all of those counties and are looking forward to continued relationships with them as well. So when I thought about and narrowing down what has been the biggest impact of expansion, these are kind of the 3 areas that came to mind when I talked to our 14 counties, both school districts and our McNabb staff as well. access. That is not a foreign word to this committee, but more rural and underserved areas receive that much needed mental health support. As I mentioned before, the funding allowed the need to be met. And that need was there before the funding was there, but that has allowed us to partner with school districts that have been asking for it for a long time. We have seen that access and that collaborative process grow as we've expanded. We've seen the word of mouth spread. I had our Union County counselor came in my office last week and said, I got recommended at a bank last week because those rural communities, that word of mouth, and that, just because a parent said, hey, my student is struggling, a bank teller said, oh, I heard that Union County High School has a counselor now. You should ask about that. That access is being talked about in these communities, and it's being promoted because of the positive collaborative relationships between these community mental health providers and the school districts. And that leads me to the collaboration that I've mentioned. School districts, school boards, schools are united in those mental health needs, and they're united with these community mental health centers because we're in partnership. And every time we train staff, we talk about partnership. That while you are a mental health professional going into that school, providing your service, you are in partnership with those schools. You are in partnership with those communities. And we have to be aware of the cultural needs within those communities. We have to address that multi-tier support within those communities. And it has to be a partnership or it will not stand alone. And so culture is the last word that I mentioned in there. Just embedding that culture, that trauma-informed culture. We say all the time that the beauty of a multi-tiered system is that it's not just about going in and doing a training on ACEs, but it's about embedding that and our staff being there to have those organic conversations with teachers about this may be why this student is struggling, or this may be why this behavior is coming out in the educational environment. And then going into the home, we provide in-home services as part of our collaboration with our school districts. And so we can educate and bridge those two environments. And so that culture takes a village. That culture takes all of us implementing that at all levels within the school district. Okay. And so just to add a little personal touch, this is a part of our team, but not all of them. This is a picture of some of our school-based staff across the East Tennessee region that we took for Children's Mental Health Awareness Week. And you all can just insert big smiles behind all those masks. We really value at McNabb making sure that our school-based liaisons have community at McNabb, because it's easy. Their school coworkers become more of their day-to-day coworkers because they're embedded within those environments. But we want them to be equipped with their larger school-based liaison community at McNabb. And so we have regular training, staff meetings, and making sure that they're equipped with their larger community mental health professional team as well. Go ahead. And so some of the successes and challenges, I just wanted to hit a few snapshots today. But when we look at national outcomes for children's mental health embedded within school-based environments, these are some of the things that we've looked at. And these are outcomes within the past year that we've looked at in school-based liaison services. 99% of students receiving school-based liaison services at McNabb were free from juvenile court petitions. We want them to be successful in their environments without those systems involved. 99% of students receiving liaison services remained in their home, school, community environments, as opposed to inpatient or residential out-of-home placement. We want them to be successful in those environments. 96% of students receiving school-based liaison services maintained attendance with no more than 5 unexcused absences in a quarter. We've seen that access to mental health services. And I always say, we reach students in school-based mental health services that would never walk through our doors at a community mental health center because of the relationship we have with those schools, because that school counselor has a relationship with a student that then connects them with us. And because that student sees us as a team, we reach them and reach their family, and they might not have ever done that on their own. That's partnership. We have more access to train and equip teachers. We hear that a lot too. And like I said, back to that multi-tiered support, we can train and equip at the global kind of that umbrella so that teachers are seeing things from a trauma-informed approach. And they, our mental health professionals, don't have to carry that torch. It's a culture. Challenges, I don't think anybody will be surprised that we've seen more acute student and teacher needs as regards to mental health support. Our tier 3 services or our direct services, our direct therapy counseling services is our biggest request. It has continued to be that, and it is probably going to be that way for a long time. Students need help, and we've tried to maximize our resources to meet those needs as well. The capacity for training over the past year has been challenging. Obviously, scheduling demands. Teachers and administrators are dealing with virtual fatigue, as I'm sure we've all had over a period of the past year, and scheduling concerns, just trying to schedule in-service days or put training on teacher schedules that go beyond their workday when we know that their stress level is so high. So learning how to balance that to where they get the information, but also we don't add fatigue or stress to them as well. Accessing larger groups of students for psychoed groups has been a challenge over the past year. That's kind of a common challenge in schools anyway, to pull a group of students out at the same time. But obviously with the pandemic, social distancing, COVID regulations on group sizes, and just disruption with hybrid learning environments has been a challenge that we've had to address. Building a culture and getting buy-in at the school level. We've seen a great success at this now. Last year when we entered the expansion and when a lot of schools were on virtual learning, hybrid learning, the switch was going on and off on whether they were virtual or not, sometimes made it harder to do engagement, and we just had to learn new ways to engage, as we've all had to learn new ways to approach and get that buy-in at the school level, because we want students to see that as a larger culture. And then maximizing our resources that we do have to reach the most amount of students. Doing those trainings, embedding our staff, providing those direct services, and being a presence within those schools has been a way that we've maximized those resources and being able to provide mental health services to a larger student population. Okay. And so these are, I call these universal challenges within the pandemic, because I hear this from at least all of our 14 counties. For those of you that oversee liaison services in other regions of the state, I would imagine that these are going to be universal challenges that you've heard over the past year as well. An increase in direct care services, wanting students to get services for mental health support directly within the school. That's been our biggest request, and we're constantly figuring out how to manage those caseloads. Looking at other resources, maximizing our staff's time to where we can provide all of that multi-tiered support, but the direct care services are what we get a request for the most. As mentioned in several others before, teachers are struggling with their own mental health, chronic stress and loss. As adults, we're not absent from this, but we bring our own selves into that. And so I've had more conversation with school districts on how to support staff over the past year than in my entire 17 years of school-based services. So that's a constant process that we look at, how to teach on stress management and how to make that an active process going forward. The lack of training capacity that I talked about earlier has been a challenge over the past year, and changing up our training formats. Staff shortages and frequent student absences. I hear that across all of our 14 counties in East Tennessee that student absences this year have continued to be a challenge. And finding students, making sure students get to school. Students being behind academically or adding teacher stress within that environment. Disruption in school schedules. Psychoeducation groups, as I mentioned before, have been a challenge just to figure out how to do that within COVID regulations. Mask mandates and managing those mandates or lack of mandates has been a challenge for staff to make sure that they're following the school guidelines and helping students and families too as well. And then less virtual and hybrid learning time this year across the districts that we've seen, but the impact of last year and that disruption has felt on the teachers and the students. And that'll be a long process from here as we go forward as well. And so one of the other quotes as I get ready to wrap up that I usually share in training as well that kind of sums up what we've seen over the past year is from a teacher that said, you know, we think kids are behavior problems or they're not interested in learning. They're not able to learn, when really, when you get down to the bottom of it, there's some experience that they've had that has taken priority over everything in their life that's going on in their life. And that experience, a lot of these kids had experiences and they have past and they have baggage, as I shared on that first visuals prior to the pandemic. with the pandemic, it's added an experience for all of us, an experience that obviously a lot of these kids didn't choose, but we have to look at it and we have to help schools and administrators and teachers look at it from the lens of how do we address those experiences and incorporate that within the educational environment so they get the social emotional piece that they need to navigate those experiences. And so obviously, like I said before, I can only give you a snapshot. And if you have a longer conversation, I'll be glad to fill your ear on success stories that we've seen with school-based services. But just within the past few months, a few quick snapshots of success stories that we've seen is in Loudoun County. We have a 12-year-old that we're currently serving that last year, the entire school year, he attended 17 days of school. 17 in an entire school year. That's a couple weeks of time. So obviously we knew that when he got referred to us this year that there was a disruption and a dysregulation there with his ability to function within the school environment. And so it would be very easily to just label that truant, right? Like, oh, well, he's been truant. We need to address him just getting to school. But because of the referral for school-based liaison services, we were able to offer a referral for parenting classes, a coordination within medication management and care coordination within our outpatient clinic in that area. We were able to provide those school-based liaison services within the school and work alongside the teachers and the school staff to address that from a holistic standpoint. And within the past 2 weeks, I just wrote this last week, the past 2 weeks of school, he's been there every single day. So as of this week, he's almost surpassed all the school days that he attended last school year just because he was linked up to school-based services with us as well. In some of our high schools in Granger and Claiborne County, we've seen an increase in people being more successful in post-secondary placements with vocational and college and them having more options because they've addressed their mental health support within their schools prior to graduation. And in Knox County this year, we saw 2 siblings that got services within an elementary school after they were found wandering in the woods after their mom had overdosed and got placed with another familial member, a grandmother. And because of our trauma-informed therapists that could go in and not only work within the family and the home, work with a teacher on interventions that she could use within the classroom to help navigate that disruption, we have seen their behavior completely stabilize within the school system to where the teachers and the school staff have seen the impact of trauma-informed care and that collaboration between home and school. And those 3 stories are just a snapshot, I assure you. So as we talk about where we go from here, the focus areas that I would encourage all of us to focus on as we're doing is just more training and hands-on support, that this is a long haul, that as we have more staff turnover within the schools, that we're constantly training on how to do trauma-informed care within those schools and set up that environment for success for students, to normalize mental health services within the primary environments that a child enters. We're maximizing direct care services and making sure they get referrals, access to our school-based liaison, other outpatient centers, and making sure that we wrap services around these students to be successful. We're pressing into that constant relationship of trust building within schools so that we have that ongoing partnership and that trust, because we know that that's where long-term successful partnerships come from and outcomes improve when we have that successful partnership. And continuing the active process, like I've mentioned, of training, modeling, encouraging stress management so that we can take care of our staff, our students, and I mean that both in the schools and as a mental health agency, that we constantly keep a tab on how do we keep ourselves well so that we can help those students that we walk into every day. And as I said, that's going to be the long haul process. And as Commissioner Williams mentioned earlier, that need for joy and peace that is needed within our school systems, and we model that and attempt to model that. One of our greatest re-ed principles and re-education principles that we always say for a child is a child should know some joy each day. And if they can end their day with a little bit of a joy and support from us through this partnership, then we've done good work that day, and we'll be back to do it again tomorrow.
Lindsay, hey, this is Marie Williams. I want to say to you, your presentation is amazing. The work you're doing is amazing. Carrie, thank you for choosing this as an opportunity to have one of our providers. We know that many of our providers across the state are doing similar activities, many of whom are on today's Planning Policy Council. But Lindsay, really, you have knocked it out of the park, and so appreciate how you put this together. I don't know if we can get a copy of your PowerPoint, I would really like to get a copy. So if someone can make sure I get a copy of this, this is great. Thank you for your service. Really appreciate it.
Thank you so much.
Right, Albert, I think we are finished. I think we might be a little over on time, so I'm sure somebody else is ready to share.
Okay, thanks, Carrie. Next up will be the needs assessment data resources. Kendra Woodward.
Deidre Woodard.
Hello. Thanks, Kurt. Good afternoon. So I've been asked to kind of demonstrate how to navigate through our webpage to find some to help you on your needs assessment. I believe Avis reached out to you all, and there are kind of 4 main things that stood out. So one of them was crisis. Another was housing. There was COVID related data, and then there were beds. So I'm going to try to open Google Chrome. I believe I'm sharing. Okay. So I think a great place to start would just be to navigate through our web page. So if we want to look for crisis data, most data can be found in this data tab. And if we go to fast facts, we can find some quick snapshots of data. Sorry, my computer is a little slow. So crisis services and suicide prevention has 2 main dashboards that you can go to. One of them, it's going really slow. One of the dashboards has our crisis teams and walk-in centers. So there are 13 teams and 7 centers. And so you can kind of look at the which colors coordinate with which provider, and look on our map to kind of see where they're located. And then the crisis walk-in centers and their addresses and contact information are listed below. If we look at the assessments, both the number and the rate are included. So if you hover over some of these counties on the map, you'll also get the rate per 1,000 residents. You can also look at years. So we have fiscal year 2016 through 2020 listed here. And if you scroll below, you can look at your particular county and kind of see the trend throughout the years. So if we were to look at Davidson County, we will see that there's been an increase in the number of assessments between 2016 and 2020. Next, I mentioned that we would look at housing. So if we go to the tab on the main link, on the main page, mental health services, we can scroll down to housing and homeless services. Listed below are all of our housing services that we provide. So there's targeted transitional support, creating home initiative, intensive long-term support, and others here. If you click on any of these, it'll give you information about the program, but also either based on the county or the region, there's a list of all of the contact information for each of the providers. Some of this information is things that you all may already know, but we just wanted to make sure that we're able to navigate it for you just in the event that you don't. In addition, there's treatment recovery, which is right under substance abuse services. And again, if you were to click on any of these, for instance, crisis detoxification, it is going. Here, there's an outline of who's eligible, referrals, and also a list of providers that you can download. Finally, beds was something that was interesting, that was listed as something of interest. So if you go to this licensing tab, on the left, you will see find a licensed facility or service. So if you click there, the second link says click here for searchable database of licensed providers in Tennessee. This creates a portal where you can query data or information based on licensed facilities in your region. So we want to look at the residential facilities, which will give us a number of the capacity or the beds available. Let's do middle since I'm in Davidson County. It will create a download link. And this provides all of the providers that have residential facilities and their capacity. So due to COVID, their capacity may not be what they're actually operating at, but you can see what they have available. So if we look at 21st Century Living Services in Gallatin, Tennessee, there are 10 beds available. Now I'm going to go back to our homepage and go to data. And here's the list of data resources that was made available a while ago. So we try to update this link before it's time for the needs assessment, because this is a list of kind of some of the frequently used data sources. One that I know is used a lot is the drug overdose dashboard. This dashboard was created by the Department of Health in collaboration with our department as well. And if you go here, the cool thing about this is that they have some of the socio-demographics listed on the left that you can choose to query on. So we look at the median household income, this map changes, and you can kind of click throughout the map to see what happened in each of these counties. So we look in Wilson County, for instance, we can see that the median household income was $71,513. We can also click on the layer below that, and we can see how many overall drug overdose deaths were there. So in 2020, there were 79 in Wilson County. In addition to the count, the rates are also available per 100,000 residents, and there are fatal and non-fatal overdose information. So right now we're on the count for fatal. You can also switch it to the non-fatal to see the map change. You can get more detailed information by clicking on any of these tabs. And it will give you a trend line. So you can see 2016 through 2019 data. You can also compare regions. So if we want to look at some of the major metropolitan areas, we can do Knoxville, Memphis, and Davidson County. We can get a comparison. We see in general, the trends have remained the same in all of these metropolitan regions, with the exception of Knoxville. There's a very ever so slight decline. Okay, we're going to go back to our page. Most of these data sources here are reports or surveys that were done by SAMHSA. So we're just going to go to the SAMHSA link here, and you'll see they're also listed here. And if you're interested in one of them, for instance, we want to go through the URS table, we can open that and download state-specific data. This is not alphabetical for whatever reason, but we can go to page 8 and Tennessee is listed. So this gives us fiscal year 2020 data for a lot of different things that the state funded or that the federal government funded. So we look at readmission rates. We can look at living situation. A lot of the information is here for 2020. We also wanted to include some data resources by different categories. And again, there are some topics that we know that were of interest. So I'm gonna highlight those instead of going through each of these. So if we go to the Kids Count Data Center, we can scroll to Tennessee. And there are some topics of interest on the left. So we can look at county-specific data. We can look at population information, free reduced price school lunch, housing, but we can also, they don't have any by the county, but they do have COVID-19 related data for the state. So there are a lot of different topics that I'm sure would be of interest. For instance, households with children who lost employment income, households where children have little or no confidence in the ability to pay their rent or mortgage. So a lot of that information is available here. Oh wait, I forgot to mention. So the TCCY has also recently published their 2021 State of the Child in Tennessee. This also has a lot of COVID-related data. You can download it from their website. So CDC has the National Vital Statistics System. If we were to navigate through their webpage, we can find information on COVID mortality. This may still be of interest. I know of interest are some other mental health information related to COVID, but you can also get the count of COVID cases for the state here. So here is for the US, but if you navigate down to Tennessee, and this is pretty much daily. Gonna navigate back to our webpage. And I wanted to show the Sycamore Institute data. So if we scroll down to this report, there's mental health, substance abuse, and COVID-19 in Tennessee. They've done a good job of comparing some pre and post pandemic data to see how some of the trends have changed. We can also see kind of where our state ranks regards to some mental health topics. So we look at depression, we kind of see we're at the 18th lowest, and these are 5-year trends. So I wanted to leave this open for questions and also to let you all share some data that you may have. One asks, Wayne King asks, is this data all-inclusive adults and juveniles with regards to overdose and fatalities? I believe that's in regard to the drug overdose dashboard. And yes, all of this is inclusive, but you are able to look at the information by age groups. Okay, that was the only question that I saw in the chat. And again, this data is not inclusive of everything that's been made available. These are just things that we know that you all were interested in and that are pretty easy to navigate from our web page. So if there's information that you all have that you know would be of interest to the other regions, please feel free to share.
Okay, thank you, Kendra. And Kendra is our MPH, Statistical Research Specialist, Office of Research, Tennessee Department of Mental Health and Substance Abuse Services, Division of Administrative and Regulatory Services. So I failed to say that initially. Forgive me, Kendra. You did an excellent job. Did we have any questions in the chat box? Okay. With that, I would like to do the wrap up at this point. If there's any other questions before we go into that, any comments? If not, I extend this body's thanks to all presenters and guests and to the members who are present today. We also extend our appreciation to Commissioner Williams, Deputy Commissioner Yancey, and Assistant Commissioner Hipple. Of course, to Avis and to Kirby, who make all of this possible, and we celebrate you today as well. Thank you personally for making it so easy for me. Our next scheduled meeting is Tuesday, February 8th, 2022 at 10 a.m. Central Time. As of now, the meeting is scheduled to take place at the usual location, Middle Tennessee Mental Health Institute. Should this change, you will be notified ahead of time. And because of COVID, we'll continue to use the precautions that we have in place now using virtual until further notice. I need a motion to adjourn.
We have Rebecca Lewis, motion to adjourn. Thank you, Rebecca.
Need a second.
Looks like Shara has seconded.
Yep, Shara Biggs. Thank you.
All right. We have the first and the second. All in favor?
Aye.
All opposed? Motion carried. Listen, if we don't see you again before then or talk before then, Merry Christmas to you all. Okay, and a Happy New Year.
Happy holidays, everyone.
Happy holidays. Thanks, Albert.
Thank you, Albert.
Thank
Thank you,
you.
everyone. Happy
Bye.
holidays.
Thanks.
Yeah, Avis. Thank you, Kirby. Thank you, Amy.
Thanks, Kurt. Bye, everyone.
Bye.
Bye.